Thank you so much, Dr. Henderson. You did a fabulous job, not only synthesizing all that we've learned, but reflecting and setting a clear course. So many of you have asked me about, well, what happens after meetings like this? You know, you did this in 1982. It's been 30 years. It doesn't seem as if anything happened in those 30 years. Is the same thing going to happen this time? The answer is no. And the reason is that we're very committed to the one thing that came out actually from my own state is Dr. Reasoner is here, who made a point of, you know, it's all about quality. You know, if we can all focus on quality and the outcomes we want, we can really work through a lot of the things we disagree on. But when it's the quality of the effort that really makes the absolute difference, and we keep focused on that, that's why we love this work. That's why we're passionate about it. And so the answer is we are going to make sure that we can translate the research agenda that is so full of questions, additional questions from 1982, but we now have more information about some areas we didn't have then. The context has changed. I think there's a lot more incentives and motivation to get to some of these quality measures than we've ever had before. So I'm very hopeful. I'm hopeful because I got to really interact with many of you in this audience, and I know you want to have that hope too. Thank you for being here. Thank you for people who tuned in on the webcast. I want to let you know that, as I mentioned before, the slides will be available next week, and you should also know that the complete video from the webcast will be available to view on the IOM.edu website, so that you will have access to that for your colleagues. You can't put on a workshop or do a committee report well without committed IOM staff. And I'd like to acknowledge those individuals. Sheila Motes, who many of you know. Sheila, please stand. And Kimber Bogart isn't here. And Douglas Konofsky. You know, these individuals have worked so hard to really help us pull this off. And the committee members, there was 8 committee members. They all participated, and I thank you so much for the time that you spent in getting these panels organized, and really, and to acknowledge Ruth Lubick, she was here in 1982. She started, and you're not going to have a speech. No.
I can't say anything?
Well, 3 minutes.
No, I don't even need 3 minutes. I just wanted to point out that I would like to see the whole term perinatal redefined to begin with conception or even preconception and go through to the child's 3rd year of life, because we're talking about families. We're not talking about silos. You know, this is prenatal care, this is birth, I appreciate all that's being done here today. And I want to thank those people who are associated with AABC, because we've done a lot of the things that have been mentioned, like accreditation and standards and so forth. I just wanted to note too that randomized controlled trials, from the beginning of birth centers, we were trying to do them. The women would not randomize, and we could not get people to randomize to us. So we have tried on that issue. Finally, I want to say we need funding to be able to do these studies, because most home birth people or even out-of-hospital birth people do not have access to university funds and things like that. So that needs to be a big consideration. And I thank you very much, Maxine, for running such a wonderful meeting.
Well, thank you, Ruth. Well, you know, we all need to thank the Kellogg Foundation because they really sponsored this. And what often happens, the workshop doesn't have recommendations. It will be a statement of facts in terms of what we discovered. However, we can take that And there are many options that may come with the workshop findings. You know, it may be that a committee does get a certain element of it, or it may be that the foundation may want to fund another activity that relates to policy. There are a whole bunch of things that could happen, but what I'd like to implore is for the states and through our state collaborations with some of the federal agencies to really get down and look and review what the policies are right now in states. And as I said before, you know, we've learned a lot of things, even that we can do in hospitals where most of our deliveries are, that can really be improved. There are a lot of unnecessary medicalization of types of interventions that we need to come to grips with and just you know, change and eliminate. But it's going to take the professions working together. And if we get focused on quality measures, then I think we can get there. Now, are you standing in line for, oh, you are? Okay.
Okay.
Yes, one brief, you know,
Okay, my
yeah.
name is Tina Johnson. I'm with the American College of Nurse Midwives. I just
Welcome.
wanted to put out there another piece that I don't think anybody mentioned. That's the need, the fact that these providers in out-of-hospital settings are the experts in physiologic birth. And we've heard how we need to study a lot of things, one of which I'm convinced is the long-term effects of the overuse of exogenous oxytocin. We really don't know how we're disrupting the pathways of normal maternal newborn changes that occur when we just flood people's receptors with exogenous oxytocin. But the other thing that I wanted to mention is that we now have things like extremely resistant bacteria floating around out there. We have situations in which we have natural disasters such as Katrina. And we have a sincere lack of knowledge about how we are going to attend women in childbirth in
Yes.
situations in which it's too dangerous to go to a
Yes.
hospital where you're
Yes.
going to pick up a lot of other infections because really your own germs are the safest ones for you to be around when you're
That's true.
delivering. And how are we going to handle this, and how are we going to create systems that will really be able to mobilize when something like this happens in the future? And I think those are other things that need to be researched, because the experts on how to do that the safest are in this room.
Yes. Thank you very much. And this speaks to the culture. We've got to change the culture and the perceptions of the majority of women who still think that, you know, they're afraid, they're fears. And we've helped create them by medicalizing the whole process of something that is really natural. And so I think that we have a lot of work to do. It can be done, but it's going to take a whole community of individuals really committed to improving quality. And the other thing, I'm a pediatrician, so this is way out of my ballpark, but let me tell you something. There's a big piece of this that has to do with child health and the trajectory that we put our children on by really optimally taking care of all women of childbearing age, whether they want to have a pregnancy or plan to have a pregnancy or not. And so I really think the perinatal period are all the childbearing age years. It really is. And the childbirth experience sets the trajectory in the first relationship, promoting first relationships, which in training, infant mental health, those were words that were not even put together. And we now know that the trajectory for mental health begins with this dyad. And that birth experience can be very traumatizing, very stressful, and it can have these neuroendocrine impacts that will develop and affect learning at later years. So there's something in it for those of us who are child health advocates. And I think that it would behoove all of us to take all of our professions, again, looking at quality, looking at the long-term implications of all that we're learning about environment, and work together to improve those things in our states individually, but in this nation collectively. So thank you for your commitment and passion, and this is not the end of another review after 30 years. Thank you so much for all that I know that you will continue to do in your communities across the nation, and we look forward to improving those long-term outcomes. Thanks again, and thanks to the staff for the support. Thank you.